students. Good morning. Today we'll be discussing about the next set of data collection instruments or methods. In that we will discuss about questionnaire and observation method today. So as we have seen, questionnaire is a very common thing which we have been using it. So set of questions, series of question, we say it as questionnaire. So in research we use self-administered questionnaire for collection of data. This is a very common tool used by the researcher, especially young researchers. So it's a very easy one. You can prepare and just give it to the samples or subjects, so they will give the response. So self-administered questionnaire is a very common used instrument. So questionnaire is nothing but a set of series of questions prepared by the researcher specific to his topic. Self-administered questionnaire, it is the one which you are going to give it to the samples and they will respond it. So we'll see how you can administer different methods of administering a questionnaire. So once the tool is in your hand, you will start administering questionnaires. So direct administration, you just directly go and give it to the clients or the patients or the respondents. So here in interview method, what we discussed is like you will ask the question and you will get the answer, and you yourself will write the answers. Whereas here in direct administration, you will give the questionnaire to the respondents and they will write it or check or putting a tick mark against the response. So the other one is mailed questionnaire. So what you can do, you can prepare a tool and send it through mail or post or through electronic medias, so that they will answer all the questions and send it to you back. So that is called mailed questionnaire. So the methods of questionnaire administration is of two types. One is direct administration, the other one is mailed questionnaire. Direct questionnaire and mailed questionnaire. So the next one is, the main thing is, what are the types of questions you can use in the questionnaire. So when you prepare a questionnaire, you have to make sure that the questions are of all of same type, and what are the different types of questions we will discuss here. Basically the questions are asked in two methods or two ways: open-ended and closed-ended. Even while collecting the histories and all, you will be knowing that types of questions are asked in two ways. Open method, you will ask a question which stimulates the respondent to narrate in their own words. So it will be an open-ended question where they can discuss so many things. So there is an example I have given here. What was the biggest problem you faced after your surgery? So here the patient can narrate everything after the surgery or whatever he wants to discuss. So this is an open-ended question. Next we'll move on to a closed-ended question. Closed-ended question is straight question which there will be an answer like yes or no. So there will be a specific response which is which is fixed by the researcher. So the answer will be very specific. There is no place to elaborate or discuss. So next type of question is demographic questions. Demographic questions are nothing but the demographic details which are asked related to the researchers. And next one is contingency questions. So contingency questions are nothing but the items may be relevant for some patients or some subjects and may not be relevant for some subjects. For example, while collecting history, you are asking whether the patient is a smoker or not. If the patient is smoker, if he say yes, then you will go for the rest of the questions like how many packets of cigarettes you are taking, how many times in a day you are smoking. So these kind of questions will be applicable. So if the respondent is saying no, then there is no answer. So this is called contingency question. Items that is relevant for some respondents, not for the others. Say if what about hospital experience? So whoever is hospitalized, they will say yes, and they will give poor, good, very good. But if they are not hospitalized, they will say straight away no. Next one is filler questions. These are all nothing but the questions which are not related to research, but you want to bring the exact response from the subject. So what you do, if the questions everything is relevant to one topic, they will somehow there will be a bias happen. So just to avoid that, there will be some filler questions added. There is some questions which are not related to the research, but it will be added in the questionnaire just to distract the respondents, which is called filler questions. And then the matrix questions. Matrix question is a type of question where there will be checklist kind of thing where the patient can tick. Say it is matrix question. So these are all the different types of questions. The very general one is open method and closed ended. Open ended and closed ended. Then demographic questions, contingency questions, and filler questions. Next we will move on to specific types of closed type of questions or closed ended questions are of different types. So when you make a closed ended question, of course you will be making a closed ended question when you prepare your data collection tool. So what are all the different types of closed ended questions you can make? The first one is multiple choice question. There is nothing needed to explain. You know what is MCQs. MCQs are nothing but there will be a response, and there will be a question, and there will be responses, and there will be one answer for them. So in a multiple choice question, it consists of two parts: stem, distractors, and key. You can say it like three parts. So one is stem. Stem is the statement, and next one is distractors. That is nothing but the answers which are wrong, and there will be a key which is the correct answer. So which is called multiple choice questions. The next one is cafeteria questions. Cafeteria questions are nothing but usually everything will be positive statements, and the respondent will select the best one. Sometimes in your questions and all, you can see all look same, but everything will be a positive statement. So which you may think that the answer is right in every choices, but you will go for something which is best, which is very close to the answer. That is called cafeteria questions. Sometimes there is NCLEX or in questions and all like that. So all will be related to the, if you read it once, you may feel that everything is right. That is cafeteria questions. The next one is dichotomous. There will be two options like male, female, yes, no. So there will be two options, and you will select one, which is called dichotomous questions. The next one is rank order questions. It's a very simple one. If rank order questions, you will list down the items and they have to arrange it in the rank. So there is example given, nursing students, how they value the list down items, and they have to arrange it in their according to their rank. For example, recreational activity, academic activity, money, friendship. So everyone will have different kind of orders. For example, for me, money, academic activities, friendship, recreational activities. So for some people, recreational activity, friendship, money, and then academic activities. So this is rank order questions. So you will ask the respondent to arrange the list down items according to the rank. The next one is forced choice questions. So here what happens, there will be two statements that represent polar by like yes or no kind of thing, where they will be forced to answer either one. Which statement most closely represent your point of view? Okay, what happens to me in my own doing? Some things I feel I don't have enough control over my life. So there are two options which you have to click between these two. We say it as bipolar questions, like bad, good. So you may feel that in between bad and good, but you cannot have an option. We say it is forced choice question or bipolar question, where there will be only two options which both are like extremes, good, bad, poor, rich. So something like that. So which has two poles. So where the respondent is forced to give one option. Next one is checklist. Checklist, you all know, checklist and matrix questions are same. So there will be list of things which they can check or respond. The next one is calendar questions. These are used to obtain retrospective information about the chronological. So if you want to collect dates, end date, birthday, those kind of dates, then we say it is calendar questions. If you are asking them something related to the month or days or day, then it is called calendar questions. The last one is visual analog scale, which is a very popular one among nursing students, VAS or VAS scale, which is nothing but the subjective experience. For example, every single person has their own way of analyzing some experiences like pain, fatigue. So these kind of physical symptoms are subjective, which can be analyzed through visual analog scale. The pain scale is an example for this VAS. Hope you are clear with this. Yes. So there are of types of question is of two types: open method, open-ended, and closed-ended. This closed-ended has different types of multiple choice questions, cafeteria questions, dichotomous questions, rank order questions, forced choice or bipolar questions, checklists, calendar questions, visual analog scales. So you can use any of these type of questions in your when you prepare a questionnaire. Next we will move on to advantages of questionnaire. Of course, there are a lot of advantages when you compare it with the interview method, because there is a question in your question paper like compare interview method and questionnaire method. So with the advantages and disadvantages you can compare and write. Questionnaires are applicable wider large number of samples. Interview, we always focus on very few samples. You cannot interview everyone. If you are taking 1000 samples, then of course questionnaire is the best method. Anonymity will be maintained. So if it is an interview, there will be a direct involvement of the subject. Here you are not asking the subject to write their name or anything. So anonymity is maintained, confidentiality is maintained. No field staff required to supervise the data collection procedure. So you yourself can do it very easily. You just go distribute and collect and do the data gathering. So here you don't need to train anyone, or you don't need to send somebody. You don't need to send somebody for collecting data. Field staff is very less required here. It's free from interviewer related bias. So while interview, the possibility of bias happens from the interviewer side. Here it clearly written by the participants, so there is nothing can be manipulated. Best method for collecting information regarding sensitive and controversial. When we talk about disadvantage of interview method, we have mentioned that sensitive methods and controversial issues related to society, they cannot open up in the interview, whereas here in questionnaire method they can open up with the answers as the anonymity is maintained. The participants will respond the items naturally. So here there is no force or nobody is watching or observing, so automatically they respond very naturally. These are all the advantages. When we move on to disadvantage, it is not applicable for the illiterates. This is a very very important disadvantage. So what you people can do is, like, you have to ask question and they have to answer. So it will be like an interview method of collecting questionnaire. So here illiterates cannot, or visually challenged people cannot attend. It has poor sample control. It may be filled by some person. So it happens, like when you give it to a college student the questionnaire, they may say, they may copy it from the friends, or it may be filled by some other people, and when you mail to the people, you are not very sure that the mailed questionnaires are responded by the right persons. Response rate is low, follow-up reminder required. So especially when you send it by post or mail, sometimes the respondents won't immediately give the response, they just delay it. So you need to follow up, keep calling them or keep mailing them, reminding them to send it back. Respondent may not follow the order of questions. So what is in your mind, which is in the question, he can interpret in another way. Okay, the way you have asked the question may affect the respondent's view. High chances for missing information. Sometimes if they are not understanding the question, they just leave it blank. This happens in the questionnaire method. So whenever you collect questionnaire, make sure all the answers have been collected, all the questions have been answered. So there is chance of missing of information. Probing and clarification of items are not possible. So interview method, you can keep asking questions and you can in-depth interviews are very effective, whereas here in-depth content of the details or the variables cannot be obtained in the questionnaire. Risk of contamination among the respondent is quite high. As I said, mailed questionnaire, someone will answer, you don't know who answered it. Bias happens quite high because you don't know whether who answered it or who will, the same thing, like when you give it to somebody, we don't know whether they are really answering it with their interest. So these are all the disadvantages of questionnaire. So questionnaire is nothing but set of or series of questions which are listed. Self-administered questionnaires are nothing but if the participants are answering by themselves, we say it as self-administered questionnaire. Methods of questionnaire administration is direct administration, mailed administration. So you can send it by email or software or post. Types of questions: open-ended and closed-ended, demographic, contingency and filler questions. And in that closed questions is of again different types: multiple choice questions, cafeteria questions. It is all will be positive statement and very the best